But it is no question, nurses are so special. They care, nurture, and help us when we're sick. This morning, we are talking to two of the best in the nation. Rosa and Daniella Cashmere are two of the 5 finalists in Prevention Magazine's nationwide search for America's most amazing nurse. Good morning.
Good morning.
Congratulations to both of you.
Thank you.
First of all, what was it like to see yourself in the magazine and to be finalists?
Unreal.
Yeah?
Surreal.
It was incredible just to, actually celebrate what we do every day and have other people acknowledge it and really celebrate that.
Oh, there you are. Those are nice. Let's talk about the process. How were you nominated to be finalists?
So my mom calls me one day and she said, "Did you see the Doctors TV show? They're running this contest. Prevention Magazine's working with them. I really think you could do this." And so she just, she's nominated me, and that was it.
Terrific.
For me, it came through my job as a staff nurse that felt like, oh, let's nominate one of ours. And I signed it up here, so it's quite amazing.
Oh, good. Well, you truly deserve it. You have a funny route to being a nurse. Because, first of all, you were a dancer at Radio City Music Hall.
I was.
And how did you go from that to I want to be a nurse? So
I went to NYU Tisch School of the Arts and was a performer for years. And right after Radio City, actually, I fractured my hip. And I wasn't walking for a really long time. I went to massage therapy school, really took some time to heal myself, heal my own body, and I was kind of amazed the impact I could have in other people's health and well-being, and I went right into nursing school.
And tell me what you focus on now.
Right now, my specialty is in palliative care. I'm at Memorial Sloan Kettering Cancer Center, and palliative care is kind of a specialty in medicine that focuses on patients with advanced illness to make sure that their goals of care are reflective of what's most important to them and really managing their symptoms as well as we can.
Daniella, I'm sorry, you work with women with disabilities, and you also did a study, so tell us about that.
Yes, so most of the populations, they're women, sometimes they were born with a disability, like cerebral palsy, spina bifida, and some of them, they tend to have an acquired disability from a spinal cord injury or from a motor vehicle accident and stuff like that. So oftentimes, these women, they tend to be prone to recurrent urinary tract infections. And it's hard to treat because it comes and goes time and time again. So I did a research, and the findings show better ways to help improve management. And with that, we're able to reduce their hospitalization rate and recurrence by 20% so far. So it's been great for them.
You've both also done work overseas.
Yes.
What have you done there?
So I was in Rwanda for a year with it's a 7-year initiative called Human Resources for Health. I was there for year 4 of it. So the program really focuses on increasing the quality of nursing preparation and education, increasing the number of qualified healthcare professionals, and really increasing the country's autonomy in terms of healthcare and decreasing dependence on foreign aid. So I was working in the military hospital as an educator in critical care, and also at the University of Rwanda to help implement their first master's program in nursing.
That's impressive. Daniella?
I volunteered with the Armin Relief Network, and when the earthquake hit in Haiti in 2010, so with the University of Miami, we went down there for a week, and we helped out down there taking care of all those found under the rubbles and all those that, it was pretty much devastating. And I'm from there. I was born and raised there, so going back was a bit bittersweet.
Wow.
But being able to go back and caring for them, that was really amazing.
One of the things, as finalists, you're able to, you get $1,000 to donate to a charity of your choice. So which charities have you chosen?
The United Cerebral Palsy Foundation.
And mine is going to a youth village in Rwanda called Agahozo Shalom Youth Village, and they were built to care for orphans of the genocide in 1994, but now they help to really give new opportunities to the most traumatized youth in Rwanda. They're an incredible organization.
What advice do you both have for people who are looking into nursing?
Well, number one, they have to understand that there's no glamour in nursing. We do get our hands dirty, from cleaning infected wounds to drawing blood. It's not for the faint of heart. And however, it is a very rewarding field, and it's a very trustworthy field. We're ranked #1 year after year. You know, we have the public's trust, and we do take pride in what we do.
I would say you can do anything you want. There's an endless amount of possibilities in nursing. There's practice, research, education. You can work in policy. There's really just an endless amount of possibilities. So be really clear about your intention and why you want to go into the field.
And also, I mean, just looking at your route there, You can be dancing at Radio City, and then something happens and you become a nurse. So there's all sorts of different routes. That's wonderful. Thank you so much, and congratulations to both of you.
Thank you
for having us. Thank you.
Let's see, you can find more information about who's going to be picked to be America's Most Amazing Nurse in the June edition of Prevention Magazine. We'll be right back.